This week on Healthy Living, addressing tuberculosis, one of the world's deadliest infectious diseases. And a new tuberculosis test promises to be a game changer in TB diagnostics. Plus, Sudanese refugees face a collapsed healthcare system in South Sudan. Finally, malaria remains a challenge in Kenya, but local drug production signals progress. That's in this edition of Healthy Living. Hello, I'm Nanit Talani. Welcome to Healthy Living. Tuberculosis or TB is a contagious infection that mainly affects the lungs. However, the ancient disease can also affect other parts of the body. According to the World Health Organization, TB caused 1.3 million deaths in 2022. The burden of TB is particularly heavy in low and middle income countries where factors such as poverty and limited access to healthcare contribute to its spread. Medical experts say a growing resistance to available drugs means that the disease is becoming more deadly and difficult to treat. TB is fully treatable and relies on timely diagnosis. Mireille Camariza, a molecular bioengineer from the University of California, Los Angeles, has developed a test that can detect the bacteria quickly, precisely, and inexpensively. Viewers Ginia Dulot has the story.
Growing up in Burundi in the 1990s, Mireille Camariza saw people dying from tuberculosis. That childhood experience drove her to become a scientist.
That has been a core motivation for the work that I do in studying infectious diseases, developing diagnostics that can be implemented in places like my home country of Burundi, where we can hopefully eradicate the diseases similar to how we have done in the global north.
Camariza is now a molecular bioengineer at the University of California, Los Angeles. She came up with a simple yet effective test to detect the disease that kills more than 1 million people per year worldwide. This sugary powder mixed with water and the patient's phlegm or blood will detect tuberculosis bacteria within hours.
The genesis of this whole project was the concept of taking something that bacteria love to ingest, a sugar in this case, and then putting a biosensor on it, and then seeing if that works, and it did work. That was great.
Existing TB tests have drawbacks. They can take weeks, like a culture test, can register false results like a smear test, or are expensive, like a molecular test, says UCLA Life Sciences Dean Tracy Johnson.
She's focused on making that dye more specific and brighter so that even very common microscopes that are available in places like field clinics in Uganda, where can even be detected in those circumstances. And that's really a game changer.
Camariza says her test shows if the bacteria are alive or dead, which helps to determine if a person is contagious. And it quickly detects if a patient is responding to treatment. And it will be inexpensive.
The powder that we make is very cheap to make. Especially when you make it on a grand scale, it's going to be less than $1 a test.
But first it has to pass a clinical trial planned in Uganda to see how well it works in the real world. If it passes, Camariza says the test would serve not only low-income countries around the world, but also California, where the state has seen a rise of TB cases in the last year. Ginia Dulot, VOA News, Los Angeles.
How much of a concern is tuberculosis for you? Have you ever been tested for TB or asked a partner to get tested? Here are some reactions from Nigeria.
Tuberculosis to me is of a very big concern, and I think it's a sickness people have to be very much aware of, because seeing people from various localities go through coughing and having the sickness is really not a good experience for me. Probably might not have had it one-on-one, but it's of a very big concern to me. Funny enough, I have not been tested for tuberculosis. Probably because maybe I have not had symptoms that warrant me to feel I have tuberculosis.
It's a very big issue that if anybody is having it, I just feel so worried about the person because I can't see somebody having that kind of sickness and feel that person is all right. I'll just feel there's something bugging the person is not fine, so it's not something I ever wish for anyone to have.
My concern about this is that at times, if I sat down, I feel sorry for the people that have it. So I feel the pain if I has the people that have that tuberculosis. I feel the pain.
Okay, tuberculosis is very scary and frightening. Anytime you hear of tuberculosis, it's really frightening because it's a transmitted disease. No, I have never been tested because I don't have any symptoms of tuberculosis.
Dr. Diraje Saleh Ayo is a pulmonologist from Fort Worth Lung Clinic in Texas. He has discussed with us things to know about the disease and how Africans can eradicate TB.
Tuberculosis is one of the most common infectious disease in the world. It can happen anywhere in the world. Can happen mainly in, it can happen in poor countries or rich countries. It can infect old patients or maybe young patients, all ages. So it's one of the most common infectious disease problems throughout the world. It's actually the second most killer next to COVID when it comes to infection. The transmission of TB is from person to person is through air, meaning inhalation of droplets. When a sick person coughs and sneezes without protecting their mouth and nose, millions of droplets will be spread into the air, and a normal person can inhale that air and get infected. Lack of prompt diagnosis. People stay home or not seeking medical advice when they have symptoms. To say the name of namely the symptoms are chronic cough. If somebody is coughing for more than 2 weeks, especially some blood-stained sputum on it, if they have fever, weight loss, night sweats, those kinds of symptoms, and especially in epidemiologically important areas of the world, they have to seek for medical attention as soon as possible. So early diagnosis, prompt diagnosis, minimizes transmission. The other important factor is patients, once they are diagnosed, they need to finish the antibiotics, especially when you have multi-drug resistance TB. You need a second line of treatment, which are very expensive. They are not available for most people in Africa. That may increase the chance of living with the disease and ultimately losing the life of patients. So in my opinion, I know the WHO has stated that they need like $13 billion a year to get to a goal. I'm not sure how much that has been practically delivered to African nations. And poverty and lack of sanitation, overcrowding, living in one room under roof, all that has a lot to play with the transmission of the disease.
Political violence in Sudan is forcing thousands of refugees, many of them children, to neighboring South Sudan for safety. There, they face a different threat: a collapsing healthcare system unable to provide them with the care they need. Sheila Pony reports from Rank, Upper Nile State, South Sudan.
Refugees fleeing fighting in Sudan arrive in Joda, a transit point between Sudan and South Sudan. 12-year-old Bahita Al-Mahad endured the grueling multi-day journey on foot shortly after being diagnosed with breast cancer.
It started with some rashes and chest pain. Then it developed into something hard, like a stone. Her skin started to fall off, and it was getting worse and worse from there. That is when we realized that it was something serious.
According to aid group Save the Children, more than 600,000 Sudanese refugees and South Sudanese returnees have crossed into South Sudan since last April. The region is already facing a severe hunger crisis and an overburdened healthcare system. For the new arrivals, this border town proved less than they hoped for.
I have recorded 194. From 194, only one women and one man.
The country's health sector got a shock earlier 2023 when international donors cut their contributions. Yolanda Awel-Deng, South Sudan's Minister of Health, says her team is struggling to fill the gap with its small share of the country's total budget.
And as you know very well, the budget of the Ministry of Health is barely 2%, it's 1.8%. And even that 1.8%, we don't get it. So, and when we get it and we try to push, the amount of commodities and also the personnel we take there is not enough.
Pahita Al-Mahad's mother says her daughter survives on one meal a day and her condition has worsened since arriving in Jeddah. Sheila Oponi, VOA News, Reng, South Sudan.
Malaria, which is endemic to Kenya, is preventable and curable, but poverty makes it deadly for those who can't afford treatment. Now, progress has been made with local manufacturing and crucial anti-malarial medication, an important step in Africa's capacity to make life-saving drugs.
At this ward in the Nightingale Hospital in Kisumu, malaria patients are bedridden. Access to treatment remains a challenge, with public hospitals often grappling with medication shortages and private facilities demanding exorbitant fees for care.
In major case, people opt to go to private facilities where they are going to get faster medication and a quality medication, but it is never pocket friendly.
About 5 million people suffered from malaria in 2022 in Kenya, and over 12,000 died, according to the World Health Organization. Most victims were children under 5 and pregnant women. Lensa Pauline regularly brings her young daughter to the hospital for treatment.
It's very expensive when treating it continuously, monthly like. It's very expensive. Somehow you are coming from a far area. Your area is far away from the hospital. There you will use transport.
Oswald Amondi is a medical officer at the hospital.
You'd like, as the healthcare worker, you'd like to give the drug of choice for first line, which is artesunate, but because of unavailability or it's just too costly for a population, most times you prescribe the drug, but the patients don't actually get it from the pharmacy due to either unavailability or the cost.
But there is hope. The Kenya-based Universal Corporation Limited last year received the World Health Organization's approval to produce an anti-malarial drug known as sulfadoxine pyrimethamine plus amodiaquine, or SPAC. It was an important step in Africa's capacity to make life-saving medications. The continent relies heavily on imported medication.
It will really help in lowering the dependency for imports, as we saw during the COVID era, where whatever was being imported actually had huge supply disruptions.
Report from a pilot program of the world's first malaria vaccine in parts of Kenya show a drop in deaths for children under 5. However, the disease is still a significant public health challenge.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. Until next time, stay well and strive to make every day a healthy day.